GCP
GMP guidelines.
Protocol,
according to
SOP, SOP, then
Regulatory
yes, regulatory requirements. So, it's a study-related activities are performed as per the protocol, GCP, regulatory requirements, SOP to confirm that basically these visits are performing. Okay. So, to confirm that by checking only the documents, they can be confirmed. By checking the subject source document only, we can confirm the subject eligibility, right? By checking the case report form only, we can confirm that what are the necessary information which need to be collected. Is it collected or not? Is the procedures are performed or not? Is the study logs are up to date? Like that things that can be confirmed only by checking these things. So all these documents, it should be this person, they have to get the chance for review this. Okay, so sponsor, they need to be ensure that these parties, they will get the direct access for this document. So for confirming this, they will mention these information like when they are coming for the visit, the study document should be provided for the review. So such information, it will be mentioned in a document. Which document will contain about it? As an agreement, in which document the sponsor will mention about this?
Clinical trial
record access.
Clinical trial agreement. So in the clinical trial agreement, clinical trial agreement, that will be mentioned that these study related documents have to be get for this party when they are coming. So it is an agreement between our sponsor and investigator. So in that, by giving this statement in the agreement, they can get a confirmation about this, and also during the trial they need to be ensure that. Then sponsor need to confirm that all the subjects are properly consented. Okay, all the study subjects are properly consented. Only by taking the consent, only after investigator is obtaining the consent, only the study related procedures was started in the subject. Like that things also they need to be confirmed. So the agreement, they have to be prepared, which contain the details about this record access. They need to ensure that these parties got the study related documents for their verification. And also they need to confirm that subjects are properly consented for doing any study related procedures. Okay. So that is one responsibility of a sponsor, record access. Then what is next? Safety information. So what we'll do here and that, our sponsor will get, in case of any safety related issues happen, they will get the information. So how the sponsor will get the safety related information? Who will inform the sponsor that for a particular subject some event happened? Who will inform the sponsor about this?
Investigator.
Investigator. For any of the subject, any issues happen, under which investigator the subject belongs to, they will inform the sponsor and the corresponding authority about this. So by getting this information, the sponsor or the vendor, they are responsible for the safety evaluation of the investigational product for the entire study. Then by this, if there are any significant issues they identified which may adversely affect the safety of the trial subject, or it may impact any clinical trial, or there is any significant issues can be happens in your subject, or it may alter the approval, then what will happen? They have to, sponsor have to inform about these informations. Like if any safety related information which is available about the investigation product which will impact our safety of the subject or which will impact our clinical trial, such information sponsor have to share to the correspondence person. So to whom sponsor need to share these safety information?
Regulatory authorities.
To the regulatory authority they need to inform it. Then
Ethics committee.
so can sponsor can directly notify to the ethics committee?
Through the investigator.
Through the investigator, they need not to be informed easy, and investigator also should be aware about it because they are the person who is directly dealing with the subject. Okay, right? Who is doing the verification of the subject? examination of the subject is doing by the investigator. So investigator also should be get the awareness about the safety related issues. Okay, so to the investigators and to the regulatory authority about the safety related information in case if anything which may significantly affect your safety of the subject, the sponsor should inform to them. So they will is there any particular any issues happen, they can do any other examinations or they can check with the subject. So to them such information should be given. Then what is this adverse drug reactions reporting? What is adverse drug reaction?
Unwanted reaction.
Unwanted reaction
Okay.
related with the drug or not related drug?
Related with drug.
Related with the drug. Okay. So in case if any adverse drug reaction happen, any event happen which is related to the investigational product and such event which is serious and unexpected, then the sponsor or the vendor, they have to inform to the corresponding authorities. Okay. Like to the institution, EC, to the regulatory authority, they have to inform about this. So these information that they will do according to the regulatory requirement. Okay, so under which regulatory authority the trials are conducting, every regulatory they will have a timeline for reporting this information. We already discussed about that now when we discussed about the FDA rule, when we discussed about the EMA, when we discussed about the new drugs and clinical trial rules, such timeline we discussed, right? Yes or no?
Yes, ma'am.
We already discussed about such timeline. So what is the timeline for India for the investigators?
24 hours within.
24 hours.
24 hours. Then follow-up report?
14 days.
14 days. So here for the sponsors, they given 14 days. Okay, for the sponsors, they can do the reporting to the regulatory authority, need to do the reporting within 14 days. Okay. So according to the regulatory requirement, so under which regulatory authority the trial is conducting, under that regulatory authority rules, if any adverse drug reaction happen which is serious and unexpected, such information should be informed to the investigator, EC, and also to the regulatory authority according to the regulatory requirement. Then also we discussed about periodic safety update report also, the sponsor have to be provided to the regulatory authority according to the regulatory rules. The safety report also, the safety update report also have to be provided. So that is another responsibility of a sponsor, adverse drug reaction reporting. Then what is the next responsibility of a sponsor? Non-compliance. What is this non-compliance? Non-compliance. Non-compliance. Compliance. What is this?
Failure or refusal, ma'am, just like.
So it is not clear.
Failure or refusal, just like non-compliance.
Like any failure to follow any rules, anything, then it will be non-compliance. Like if you did not run any activities according with the protocol, if you did not follow your SOPs, or if you did not follow the GCP, or if you did not follow the regulatory rules, then we are using the term non-compliance. Like if you did not run any activities as per the rules and regulations, then we are using this term non-compliance. Okay, so it can be happen during the clinical trial if any non-compliance can be happen. So if any non-compliance happen with a protocol, SOP, GCP, or any regulatory requirement, it can be happen maybe because of the investigators or any member of the investigators or any member of the sponsored team. So they need to be verified, like the sponsor or the vendor, they need to be verified that is this non-compliance which significantly affecting our human subject protection. Okay, because of this non-compliance, is there any issues can be happen in the trial subject protection, or it may affect any study result. Okay, so the sponsor, what they have to verify, is there any non-compliance issue happen? So if any non-compliance issue happen, which may affect the safety of the subject, or it may affect the study result, they need to be verified about this. So if any issues which they identified, what they have to do, they have to perform the root cause analysis. What is this root cause analysis? Root cause analysis. Root cause analysis. Hmm?
And
What
these
is root cause?
main cause.
The main reason behind the problem.
The reason why
Cause.
this happened. Okay, so why this
What is the
happened?
reason
They
behind
need
it?
to be checked. The reason for this issue, they need to be verified it. Then they have to implement corrective and preventive action. Why we are doing this corrective and preventive action?
If any deviation happens, then for the compliance, we have to we have to make some changes in the SOPs. So we have to take that kappa, that corrective action and preventive action.
Mm. So why we are doing this corrective and preventive actions? For avoiding these issues in
Future. So that in
future.
Yes, ma'am.
We have to avoid the same issues in future. So for that, the corrective and preventive actions. So in case of any deviations, any violations happen, they have to be checked that why it is happened and by whom it is happened. Is there any safety related issues happened and how we can correct this? Okay, so what are the necessary action which we have to be take it for avoiding this in the future? They have to be check it. So maybe they will give proper training to the. Okay, like that, any action they will take it. So, if any during the time of the monitoring or during the time of the auditing, if any serious issues which they identified, maybe the serious issues which is done by the investigator. So, what will happen if it is a very significant issue? Then, what the sponsor will take it. Suppose investigator, they identified that investigator is not taking the consent properly, or they identified that they done some fabrications in the records. Like sponsor identified from the site. So what the action will take by the sponsor? They will
Stop.
Terminate the study.
Will terminate.
Is it terminate the study or terminate that particular site?
That particular
Site.
Terminate
That
site.
particular site only. They will not terminate the complete study at that particular place. At that investigator site only they will terminate the trial. So if any trial is terminated, such information should be informed
To the regulatory authority.
to the regulatory authority. Yes. So when we discussed about this, about the different regulations, also we discussed about this. In case if any termination is done, such information have to be notified to the regulatory agency also. So who will notify the regulatory agency about this termination or the suspension related information?
The sponsor.
Yes, of course. The sponsor, they will inform to the regulatory agency about the suspension or the termination with
Reason.
what?
Reason.
Yes, right, with reason. Okay, the reason also they have to be informed. So that is also the regulatory timeline they have to meet for it. Okay, so under which country we are conducting the study, that particular country regulatory timeline that also have to be made for this reporting. Okay, so that is another thing. Then what is the next responsibility?
Monitoring.
Monitoring. Yes. So sponsor is responsible for the monitoring of the clinical trial. So monitoring, which they are conducting, which is to ensure that the trials are conducted according to the protocol, GCP, SOP, regulatory requirements. Okay. So for this purpose, the monitor, they will the sponsor, they will appoint a person to do the monitoring. Who is the one who is conducting monitoring?
independent of the monitoring committee.
No.
Monitor clinical, I mean the monitor.
So CRM.
CRA or the monitors, clinical research associate, they will conduct the monitoring at the site. So for every site, sponsor will allocate the monitors for the study. So they will do the monitoring of the clinical trial. Okay. So what is the purpose of the monitoring? The purpose of the monitoring means they need to be confirm that the right safety, well-being of the trial subjects are protected. Then whatever the reported data, which is accurate, which is correct, which is verifiable from the source document. Then, as here it is mentioned, the trials are conducted as per the protocol, GCP, SOP, regulatory requirement. For this purpose, the monitoring which they are conducting. So, for conducting the monitoring, the monitors are required. So, sponsor is responsible for the selection of the monitors. Okay. So, monitors have to be appointed by the sponsor, and they have to ensure that the monitors are qualified, trained, and experienced to perform the monitoring activities. Then, which type of the monitoring have to be do for the clinical trial, that is also determining by the sponsor. Like, is it on-site monitoring is required? Is it centralized monitorings are required? Or both these centralized monitorings and the on-site monitorings are required? Like, which type of the monitoring is required for the study, that is also determined by the sponsor. Then they will prepare a monitoring plan also. Do you know what is a monitoring plan? Monitoring plan.
Procedure for monitoring.
Just like they have a responsibility to
The responsibilities.
either they are following GCP guidelines or SOP guidelines or not. Yeah, all like that.
The responsibilities of the parties which is involved. Then about the monitoring method and the rationale for choosing such monitoring related information, that will be mentioned.